More than 100 million Americans have diabetes or they are pre-diabetic.
That's right. And a popular drug used to treat diabetes is now being used just to treat weight loss. And we're going to get to the bottom of that.
And this is Chick to Chick. You know, it's funny how podcasts come about for us. Mm-hmm. And this was... You know the story. Right. So I'm sitting there one night and I'm watching this reality television show with my son, and all of these young ladies are on the beach in bikinis and whatnot.
Were they really bikinis?
They were really bikinis. So teeny tiny, itsy bitsy. And I said to my son, oh my gosh, these girls are so tiny anymore. They're so thin. And he said to me, well, Mom, you know big butts are out. And I said, no, I didn't know that. And he said, yeah, the girls are all getting their implants taken out. But then he said to me, and I said, yeah, but they're so thin and they're drinking and they're eating. And he goes, oh yeah, they're all on Ozempic. And I go, wait, what? Huh? And then I said to you, and I told you the story, and I said, blah, 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 blah. And you said, before I even finished the story, you said,
well, they're all on Ozempic. That's what's going on.
What is going on?
Yeah, and I think it's really frustrating, and I always find it unfair and ridiculous when there's a subset of, culture where they are taking over drugs and medications that are really used for people who absolutely need it. And it is troubling. And I really only have a few family members that have dealt with diabetes in my family. My grandmother, my uncle. I don't know a lot about it, but this really made us want to understand more about diabetes and then tackle that whole Ozempic thing. So we have two wonderful guests today. We have Samantha Heckel, and she is a person who is living with type 1 diabetes. And we also have, what is interesting, her doctor, since she was like 13 years old, Dr. Joshi, and she is an endocrinologist. So thank you both for being with us today.
Absolutely.
Thank you. Doctor, I don't get this. When my son said to me, oh yeah, these girls are on Ozempic, I'm like, what? How is this happening that a drug that is supposed to help people with a medical condition is now being prescribed to people who don't have this medical condition just to lose weight? How is this happening, and why is this happening?
So there are a couple of things you must know, that one of the biggest precursor for diabetes is weight gain. So the more weight you gain, the more chances are that you will become diabetic over the next 5 years. And Samantha can tell you all the prevalences and incidences, but it is pretty common. 1 out of 10 people are diabetic in this country. And by 2050, we are thinking 1 out of 3 will become diabetic. And one of the major precursor is weight gain. So Ozempic was actually approved in 2017 to control diabetes. And one of the biggest way it controls diabetes is by losing weight. It causes weight loss of somewhere between 5% to up to 15% in some patients. So if you think about a person with 200 pounds, they can easily lose 30 pounds with this drug. And how does it happen? It actually lowers their appetite because it just slows down your stomach. So you can't put as much food in your stomach as you were doing before. So because you're eating less and then there are many hormonal changes, you lose weight. So back in 2021, the drug companies started to evaluate people who did not have diabetes to see if they would benefit by this drug by losing weight. And if we could lose weight in normal people, we would actually prevent development of diabetes. So it was done in a very good faith, and it's still used in a very good faith. So the drug was approved in 2021 for just obesity, which means anybody who is overweight and has a BMI above 30, and we can get into that more if you like, but anybody who is obese, if they take this drug, the drug can cause up to 15% of weight loss. So you can imagine a 300-pounder taking this drug can lose up to close 60 to 90 pounds, which is very good. And that's why the drug is being utilized in patients who do not have diabetes.
And so what happens if you're a patient who doesn't need to lose that much weight and you're honestly just doing it for vanity, really? What can be some of the downsides to having that?
So what I'm thinking you're actually referring to the Ozempic craze, which has happened among celebrities, and that's what has come on the Oscar and everywhere else. And obviously, a lot of people are just taking it for the sake of taking it. So there are two issues. Number one, you will lose weight, but if you don't follow a diet, you're not going to lose weight. So the drug is not a miracle that it's going to keep losing weight, even if you don't eat the right food. So yes, if you're eating, drinking, and doing everything, it's not going to cause weight loss. The second thing, as soon as you stop the drug, the weight is going to come right back. So it's not going to help you. So yes, you are losing temporary. That's what people are doing, that they lose a temporary weight for their wedding and for other things, or 6 months, and then they go back and do what they like to do. There are side effects of this drug, which are mainly, again, temporary. There is nausea, vomiting, abdominal pain, diarrhea, and some people get really serious one. And there is some data, and I have to mention this, there is some data which is coming out that there may be a very, very slight correlation between slightly increased risk of thyroid cancer. We don't use these drugs for people who have a special type of thyroid cancer, which is medullary thyroid cancer. That is very uncommon, but the people are also starting to see a link with the other thyroid cancer. That is, the report is still out to jury is still out on that one, because we don't know if that's going to prove out to be right or wrong. But every drug has some benefit and some harm, and you're going to see them more the more you use them. So the drug is great for obese patients who are doing aggressive diet, aggressive exercise, poor fellow, not able to lose weight, and then they have prediabetes and they're trying to be healthy. The drug is for them, but not for every Tom, Dick, and Harry.
I love the explanation that you just gave, and it provides a whole lot of clarity. So Samantha, you're living with type 1 diabetes. How does this make you feel when you have a medical condition that you have been dealing with and struggling with your whole life, and then you hear that celebrities are taking this just to lose weight?
I mean, of course, I don't think it's the right thing to do. I like that it's been broadened. The parameters have been broadened for more folks to take it that need it. But of course, I think I'm curious to see who's prescribing these to the folks that shouldn't really be using them. I mean, I guess when you're a celebrity, you have connections, but it does make me wonder, what are these doctors doing, and why are there so many that are willing to give Ozempic? There's another side to this too, is that it's very expensive, and getting the insurance to cover can be a tricky game. And I know Dr. Joshi has written many, referrals and prior authorizations and battled it all. But these types of drugs really do. I like that I can see, I have a extended family member, not diabetic, but seriously needs to lose weight and for health reasons, and just got approved for it. So I'm happy for her, but it's really not necessary for any other reason. And these doctors who are prescribing these celebrities and whoever else, I don't think it's the right thing to do.
So if I can jump in, for a second, I want to answer two things. Number one, Samantha is absolutely right. Because there were so many other people taking the drug, our type 2 diabetics, we had a big shortage for almost 9 months, and they could not get the drug, which was so bad because their diabetes got worse. The other thing, which we are also seeing, that as celebrities are taking, there's a lot of compounding pharmacies who have started making this drug. Novo Nordisk is not making and selling this drug to everyone. That is for sure. And that approval process is pretty tedious, as Sam said. But compounding pharmacies are making this drug, and we have no clue where they are using this generic semaglutide, as it's called, where they are getting this drug. So it has to be coming somewhere outside US, and then they're compounding it and selling it to people, which is not the right thing to do.
Wow. Super interesting. Well, I think something that's really important is understanding diabetes, type 1, type 2. Not everybody understands it. You two have been in a partnership since Sam was 13 years old. But Samantha, tell us about what you were having, how the symptoms were for you, and how you first became diagnosed.
Sure. I have, since I have been diabetic since I was 13, I have a very big diabetes community. I've done diabetes camps. I'm part of organizations. So I literally always say that I know hundreds of diabetics. And the one thing all of us agree is that we wish type 1 and type 2 were called different diseases, because while they're very similar in your body, they're not on the surface. Basically, I was told growing up that, type 2 in most cases can be preventable. You can treat it with diet, exercise, and some medication. Whereas mine, type 1, there was no way I could have prevented it. I was born with it, so to speak, but it didn't kick in, I should say. My pancreas didn't stop working until I was 13 years old. So the symptoms, like you asked, first off, I was losing a ton of weight. Big misconception here. When you're not treating diabetes, your body is trying to flush out all that extra sugar, trying to excrete all of that extra sugar through your urine. So I was losing weight like crazy because I was essentially living with undiagnosed diabetes. I didn't have any insulin to break down my sugar. So my mom was like, okay, 13, maybe she's just having a growth spurt and like, losing her baby fat, but I lost so much weight as a 13-year-old. I was very thirsty. I even wet the bed when I was 13. And my mom was like, okay, that's not normal. And I think one of the bigger things too was that I had gotten a yeast infection too in one summer. And my mom was like, why does my 13-year-old have that? And so whenever I went to the doctor, they were like, she could be diabetic. They found a lot of sugar in my urine, and then I did a blood test to confirm that. So that's the symptoms. And for me, I had it lucky. I was only diagnosed with a blood sugar of 200. A normal blood sugar is around 80 to 130. I know people who are in the thousands. They're helicoptered to a doctor, to a hospital because they're near death. So we caught it very early. But those are the signs. And when I hear other parents, give me some of those symptoms, I'm like, you might really want to get them checked because it can get very scary very quick when it's undiagnosed for so long. My mom was just smart and she picked up on weirdness right away.
Thank goodness for mom. Believe it or not, I mean, this conversation has gone very quickly. We're running out of time very quickly. What are your final thoughts from both of you, Doctor and from Samantha, on this whole topic of Ozempic, and what do you want people to know?
So a couple of things which I think Samantha did not cover. The 90% of the population does have type 2 diabetes, which is the more common kind, which is preventable. And that is the one where weight loss is important. And that is why Ozempic is important to take for those people who are pre-diabetic, who have a BMI above 30, who are doing aggressive exercise and diet, who have high blood pressure, who have high cholesterol, who have gestational diabetes. So these are the folks who want to prevent diabetes. And if they want to take Ozempic, they have to go to their doctor, get the right prescription, and then take Ozempic. For Samantha, who is type 1, is a different disease. It's autoimmune, which means you have antibodies. So you can't do anything about it. And even though the drug can lose weight in type 1 diabetic, it is not approved for type 1 diabetic at all. So people who do not have diabetes and they're just doing it for a fancy term, as I call it, the celebrity word does it, I think they need to think about people who really need it.
I'm of the mindset that if it's needed, absolutely. I love that, more people are having access to it to prevent type 2. But again, it's really not a drug to be abused. And it is horrible that there's shortages here and there. And I'd love to see it be put to good use only.
Does it anger you, though, to hear that people are taking this just for weight loss?
I mean,
in the wrong way, you mean?
Yes, in the wrong way. In the wrong way,
yes.
In the celebrity way.
I think so. Yeah. I mean, there's a lot of, it angers me when I hear of folks who can't get their prescriptions, like my family member. That angers me. Everyone's going to do what they're going to do in life, and I can't change the world. But, when there's shortages, that's a real problem.
Absolutely. Mm-hmm. Dr. Samantha.
Great stuff.
Great information. Thank you both for coming on the podcast. You both have offered a lot of information that has provided a lot of clarity on this whole situation, because I was clueless on Ozempic. I had no idea what this was about. Right. So thank both of you for coming on and giving us your time and this information.
We appreciate you.
No, thank you so much for inviting us. Our pleasure.
Thank you.
I mean, do you feel better now?
I do, because I really didn't understand when my son said, oh yeah, they're all on Ozempic. And I'm like, what? Now I kind of understand. I have a better understanding of what this drug is for, what it does. I have clarity on all of that, but I still don't like the fact that people who aren't diabetic and who are taking it for the wrong reason, simply to lose weight, that whole celebrity world, I think that's wrong, and I think it's horrible that people who really do need this drug are waiting for months to get it.
Or it's costing them so much more money, because a celebrity can't afford it. It was all great information, lots of clarity there with it. Good stuff to think about. Yep. We appreciate you being with us today. And do us a favor, head over to our YouTube page, Chick to Chick on YouTube, like it and subscribe to it. And until we are back to chirp about another topic.